Hi, my name is Brett Parker. I'm the Managing Director of SAP Africa. There are several challenges that are facing both the private and public healthcare sector across Africa today. In no particular order, I mean, some of those challenges include things like access to medical treatment in some of the rural and remote areas. There is, of course, this challenge around patient information and patient record management in terms of getting access to, by doctors and health providers in terms of understanding the patient that they're dealing with. Then, of course, there are some other challenges around silos of information. So, unfortunately, the situation now is that there are certain organizations that have patient information. However, that patient information may not be available to other organizations. The cost of healthcare is another big factor for Africa. Obviously, I've mentioned the access to healthcare. Then there's additional challenges around the distribution of some of the medicines, and not only the distribution but also the management of the distribution of the medicine across the continent is a further challenge that faces the healthcare industry for Africa. And then obviously we are faced with some dread diseases and other challenges where information around not only the patient's health records of the past, but also some preventative treatment that could help us in terms of dealing with some of the dread diseases across the continent. So these are the main challenges that we see in terms of healthcare in Africa, in both the public and the private sector. How can technology assist in improving the overall healthcare industry across Africa and the patient experience? So technology could play a really major role here, and I mean, just if I think about some of the challenges that I've previously mentioned, silos of information for patients, I think there's a big opportunity for a single integrated platform, or what I would call a business network. And I use the term business network because I honestly believe that the cloud, a cloud-based technology, would be the most cost-efficient and most elegant way for us to deal with the siloed information, so that we could have a platform to share information about patient record management and all the other aspects related to their treatment and other things, no matter which organization, both public or private, needs access to that patient information. So that would be the one aspect that I would think should be a key area of focus for us in Africa in the short term. Mobile technologies play a huge role even today. We have several customers that are using SAP mobile technologies to provide solutions in rural areas. I mean, one of the things that we have published previously was the birth registration application and solution that runs on any mobile device and is secured through the SAP Unwired platform into the back-end systems that we provide the information to. And so mobile for us is a very key technology because it enables us to take these solutions to rural areas and through things like mobile clinics where typically some of those patients could not get access to treatments, healthcare providers, doctors, etc. So mobile very key. There are other solutions that I think would really build the platform for us to deliver some of the things around mobile and others. So, for example, ERP would be one, the Enterprise Resource Planning Solutions, and then there are other solutions that we have, for example, hospital solutions, clinic management solutions, and other vertical solutions, industry-based solutions that really provide you with a platform so that you're able to treat patients, with the right information at the right time at its point of value in the system. So again, mobile extending onto iPads where doctors have access to the current information and are able to treat patients without having paper-based solutions and other things are very important to the effectiveness and growth of healthcare across Africa. And then, when we start thinking about real-time data, access to information and to capture it into a system immediately as the treatment's happening and as the records are required to be stored. Then there are smart technologies like in-memory computing where products like HANA really provide those caregivers, healthcare givers, doctors, etc., real-time data at its point of value in a on a platform of their preference, whether it's an iPad or an iPhone or even an Android device, whatever they may use. It can be delivered real time through the power of HANA and some of the other technologies that I mentioned. What are some of the innovative solutions that we are currently providing across Africa as SAP? I previously mentioned the birth registration mobile app, which is one. We also have a solution which is the surveillance and outbreak response management system, or SORMAS, for some of the deadly and communicable diseases such as cholera and measles and Ebola and others, which allows to capture that information and make it readily available to those countries and public and private health institutions that deal with that on a daily basis. We have the connected health solutions from SAP, where we bring these different aspects of healthcare across different platforms together to provide the technology and the information at its point of value within the ecosystem. We also have the medical insights and research that we are busy with some of our partners across Africa. So an SAP initiative where we partner with other organizations to deliver some research into innovative solutions for healthcare. We have the mobile EMR Unwired platform, which is also ready available for mobile solutions. And then we also have the Banking for Blood solution that is being delivered through SAP technology. So there's a few initiatives that are currently focused around innovation and to really help assist us in Africa to bring the best kind of healthcare and experience to people across the continent. We have a number of customer success stories across Africa through our partnerships with some of those organizations. I mentioned the blood example earlier. That's in partnership with the National Bloods of South Africa. We have some hospitals that we've partnered with. An example would be the eThekwini Heart Health Hospital. Another good example would be the Albert Luthuli Hospital. And then we have some large customers that we are continually working with through not only building platforms but innovation with those customers. Those customers include the likes of Netcare and Mediclinic, a couple of the biggest private health providers within South Africa. And then we have some other hospitals that we have strategic partnerships with. Gateway Hospital, Hillcrest Hospital, and then there are some very important customers of ours in the pharmaceutical industry that we work very closely with. Dischem would be an example of one. Big customer of SAP's. Another important customer of ours definitely is Aspen Healthcare, where we are busy building up platforms not only within South Africa but also globally. And looking at some innovative solutions with them, and then an important partner would be Imperial Life Sciences, who we've partnered with over the last few years and built out some smart technologies on mobile applications and other things. So a lot of innovative and good success stories across the spectrum of the healthcare industry, in particular in South Africa, but also a little bit globally and also around the rest of Africa as well. In closing, I would just like to make the point that I think there is a huge opportunity for us in Africa to leapfrog some of the solutions into the healthcare industry. One of the advantages we have in Africa is we don't have a huge amount of legacy, from the past. So many of these solutions we can put them in from a fairly kind of new position without carrying the legacy with us, and that would enable us to do things with quite a lot of speed and really get these solutions delivered across Africa, not only at less cost but also at a far faster rate than what typically would happen in a mature market. So emerging markets definitely have a good opportunity there, and as we all know, mobile is very pervasive across Africa. So we could also leverage not only the mobile technologies, the mobile partnerships with the providers, but I think even things like social media and other platforms would allow us to get to patients and deliver these types of solutions with a great deal of speed and agility. From an SAP perspective, I guess that's a summary of our view of healthcare. My name is Brett Parker. I'm the Managing Director of SAP Africa, and thank you for your time.